Hello, this is Charles Epstein, host of the Catalyst Podcast. Today I'm joined by Patrick Hibbard, Assistant Research Scientist with Chestnut Health Systems. I usually recite our guests' credentials, what it is they do, the respective organization. These podcasts, mainly Chestnut and Lighthouse. But Patrick, I'm going to give you the floor. I'm going to change things up a little bit. So maybe you can tell us a little bit about what it is you do for Chestnut.
Yeah, sure. As a assistant research scientist, I work on grant-funded projects doing mainly research, some kind of training and implementation stuff around substance use, the criminal legal system, stuff like that. Kind of run the gamut, everything from we have worked on some motivational interviewing interventions with people like young adults who are going through treatment services for the first time, mainly focused on trying to help them complete treatment. Since young adults like 18 to 25 is really high dropout rate from substance use treatment, stuff like that. Also did some motivational interviewing stuff for SAMHSA, like some training stuff. But also like my true loves, and don't get me wrong, that's great. It's been amazing to work on those projects. Are kind of twofold. One is working on sort of community levels of impact for policies and programs and stuff like that. I'm sure we'll get into some of that shortly. But basically, you put a program into a community. What are the impacts on that community? Is it, having its intended consequence of helping people having a healthier community? Or, are there some unintended consequences or, something that we didn't really predict that would happen? And then the other stream is trying to incorporate people with direct lived experience into the research enterprise, whether that's researchers like myself who have direct experience with substance use issues, criminal legal systems, stuff like that, or people working on research teams, research assistants, coordinators, stuff like that, but also do a fair amount of work with like creating community boards of folks who are on the ground, either are in recovery from substance use themselves, peers and providers of services, or something in between.
Right.
But
Right.
yeah,
It is kind of interesting. I just want to make a comment, an observation that when people hear research scientist, particularly when it is a chestnut research scientist, I'm hoping that at this point in this podcast series, people understand it's a little bit different. Usually it automatically means somebody in their ivory tower, but everybody, chestnut, as you're talking about, the impacts on the community, it's not just this stuff that's untethered 30,000 feet above
yeah,
reality. It's obviously in the community and testing it and
yeah,
retesting it and applying it and reapplying it. Just want to make that
yeah,
point.
yeah, yeah, absolutely. And it's an interesting sort of combination. I mean, I would in a way push back as far as there's this sentiment that sort of purely academic work is kind of isolated and separate. But I think that there is a use for developing models and larger sort of theories for things like social phenomena, like substance use, treatment, things like that. But there has been a big divide between sort of what actually happens on the ground and what the academy, as it were, comes up with. And I think Chestnut does a good job of kind of bridging that gap between what's going on. I mean, the larger part of the organization is a clinical provider.
Mm,
So
yeah.
I should hope that there's
Yes.
some, bridging between actual
Yes.
clinical services
Yes.
and the research
Yes.
about those very services.
Yeah, which is why it's a natural theme for us to sound with all these podcasts and the work we're doing. So you're calling him from Albuquerque, correct?
You are correct.
Ah,
Sunny Albuquerque.
sunny Albuquerque. I automatically, and pardon me, automatically associate Albuquerque, as many people do, with Breaking Bad. I know
Mhm.
that's a terrible thing to say, but
Oh
hey.
no. No, I mean I'm from here. I grew up outside Albuquerque and I know um the drug scene here very well. Been involved in it myself and a lot of the places in Breaking Bad, like I know some of the spots where the filming was done. Some spots in a very intimate way.
And we're beautifully set up for what we're going to get into now. Anyway, Patrick, first, let me tell you, I really do appreciate you spending this time. I also appreciate some of the things we're going to be talking about. I've been interviewing people for various podcasts over the years, and one thing I've found is that few have linear career paths. It's usually a series of unexpected twists and turns. But I have never, ever spoken with anyone whose career path is quite like yours, Patrick. And I do want to talk about that a bit. We spent a good portion of our first conversation on that because it's
Mhm.
unavoidable, because it's such a fascinating story, how you got to where you are, and how that journey deeply informs your work.
Mhm.
So let me just frame it or ask it in this way. 20 years ago,
Mhm.
wherever you were 20 years ago, could you ever have imagined, Dr. Hibbard, that you'd be currently doing your work or the work that you're doing?
Yeah, no, not at all. 20 years ago, 2005, I was in the jail here in Albuquerque, fighting about 2004. I was arrested 9 times for various activities in the kind of drug world here in Albuquerque, and that was in recovery. They talk about three different stages of recovery, right? Well, the 12-step fellowship I go on, we call it sober, right? So there's like getting sober, staying sober, and living sober. Getting sober is hard because you got to stop, right? And there's like physical dependence and all these other things. And my hats are off to people that like just say, I got a problem, and they like go to detox or go to treatment or stop, or whatever. My method was to get arrested enough times where they made me stop. I don't recommend that as a way to stop using substances, but we do have
Was that,
criminal.
Let me ask you, Patrick,
Yeah.
is that an insight you have after the fact, or that was something that was very
Oh,
intentional in the
yeah.
moment?
No, it was not intentional. It was after the fact. It's mainly it's tongue in cheek because I will say in 2005 I hadn't fully stopped using substances. I was even though I was in the jail, we would get whatever we could to kind of at the time I mean the real definition of what I was doing was self-medicating, but I hadn't completely stopped until about 2006 ish. But that's long way of saying, yeah, 20 years ago I couldn't have imagined myself not being incarcerated, let alone being able having the privilege of the amazing career that I have today.
Was there that physical, pivotal, life-changing moment, or is that kind of a
Mhm.
cliche? Was it an accumulation of
Yeah,
things?
no, it's yeah, it's so there was a couple of pivotal moments. And I mean, it's pretty common. It might be considered cliche, but from the folks I know in recovery, there's different sort of moments. There was two. The first one about 2006. I had finally gotten all those 9 cases wrapped up into a plea bargain, signed for roughly 4 years of incarceration and 5 years of probation. I went and signed the plea bargain, but I hadn't gotten sentenced yet. And I went back to the jail from court after signing the plea bargain, and I got caught with tobacco. And in New Mexico, this was a non-smoking facility. And in New Mexico, that's a fourth-degree felony, which itself only carries 18 months of incarceration only. But I'll add to that that's a violation of that plea bargain that I had literally just signed, right, for those 9 cases. So that's the 10th case You stack all those on top of each other, and that's a lot of time. In addition to, by this point in my life, I'm a career habitual offender, which would add, 4 to 8 years. They could stack each of those cases. And, basically I had given up decades of my life for a tiny bit of loose tobacco. And so that was kind of the first pivotal moment.
Yeah, yeah. No, it's an amazing story, and yeah, I know through this winding path, this winding road. Again, we're going to get into some other things right now, but
Yeah.
your story is unusual. It's fascinating and compelling, and again, it clearly informs your work based on our conversations. I'm
Yeah.
not
Yeah.
making that comment. It's from some of the things you said. You got an MBA, but how did you ultimately get into the work you're currently doing?
By accident. I yeah, I mean, really what happened, I got my MBA here at the University of New Mexico. The goal was to help nonprofits to do better, more, kind of stuff. And, did some internships throughout that MBA, was the top of my class, was the graduation speaker, all of that stuff, and then moved to Florida after graduating and with my fiance, and I couldn't get a job, so I ended up selling advertising over the phone. And I do not like sales. I'm good at it, but I don't like it. I don't like that part of me that tries to convince other people to do something they may not want to do. We moved to Indiana so my wife could get her master's in fine arts. She's a printmaker. And I met the right person who introduced me to the director of a PhD program there and just kind of dropped my story in front of him. It's like, look, I feel like I can do more. And he said, yeah, I agree. Here, let me walk you through the application process. And I got into their PhD program at the O'Neill School of Public and Environmental Affairs. And then kind of fast forward to when I was wrapping up that degree in 2020, ended 2020, early 2021. I think it was right in January 2021. A friend of mine sent me a job posting that was looking for researchers with lived experience. And that was the Initiative for Justice Involved in Emerging Adult Populations, the JEEP initiative, which is one of the big projects that we have here at Chestnut and Lighthouse. And that was kind of the first opportunity I had to fully merge my direct experience with recovery, with the criminal legal system, all of that into my career. So, to as it stands now on the Chestnut website, it says, Patrick Hibbard, I think it says something about, he's motivated to do this work, having direct experience with recovery in the criminal legal system or something like that. So
Yeah.
my recovery and personal history are merged in with my professional identity.
Well, that sort of gets us a little bit more up to date. In our conversation, actually, in our conversations with Chestnut Lighthouse people, we talk about implementation science, translation science, and so on and so forth. I know based on our conversation, a lot of your work is steeped in econometrics and quantitative methods. Maybe if you would speak a little to that, how you use that in your work in evaluating public health interventions like drug courts, which we'll get more into in a moment.
Yeah. Yeah. I mean, well, back up a little bit and, really the way I approach the research questions that I end up investigating in kind of an agnostic way, right? Like there's a lot of stuff we don't know, right? Like one of the things is the connections between different organizations and efforts in sort of the recovery ecosystem. And so take an organization like a 12-step group, they have a direct policy that states no formal connections with other organizations, right? but they have this influential role within the whole recovery ecosystem, right? And they obviously impact other organizations, and other organizations impact them. For instance, like you mentioned, drug courts generally require people to go to meetings and have their papers signed, right? So that influences how many people are going to, especially say like a smaller town. If the drug court starts ordering a bunch of people to go to meetings, now you have this big influx.
Right.
Or on the other hand, if they, change how they operate or whatever, so there are these impacts. And so that required more of a kind of a qualitative approach in investigating how do these different organizations function when there's this one that has a complete ban against direct formal contact, right? And then, there's actually a paper we put out there that has to do with the informal connections, individuals that inhabit the different organizations, et cetera. But from a methods perspective, the question, we don't have quantitative data to look at it, right? Um, Generally speaking, though, on a lot of public health research, we do have some data. We have fatal overdose data, we have non-fatal overdose, we have crime, we have service usage, things like that that we can measure at the community level. The problem then becomes, how do you tell if this thing is causing changes in that, right? Causal inference. How do you make the connection between like a drug court and changes in crime, changes in overdose, or these changes in the community? And that's where the econometrics comes in, is basically just trying to answer the basic question of, does X have an impact on Y? Right? And is it X that is causing the impact on Y? A lot of times, it's like we think we're pretty sure that
Yes.
this is having an impact on these outcomes that we're interested in. Here's as close as we can get to making a causal claim that this is causing that. So
Yeah,
that's
which of course begs the question, drug courts. If you would, we actually spoke about this in a previous podcast. If you explain to our listeners who aren't familiar with the way they work, how they work, and what some of your research has revealed about this causation, their effectiveness.
yeah, it's so I mean, there's drug courts have been around for a long time. Like the first one was implemented in 1989 by name, Miami-Dade County. And the innovation really has to do with the very structure of the court itself. So our judicial system, quote unquote, I say that because I don't see a lot of justice, but our jurisprudence is set up in an adversarial structure. So you have the prosecutor, you have the defense, you have a judge that kind of weighs in between, hence the scales, right? And it's supposed to be blind and all of that. And the point being, it's kind of like our political system, right? You have people pushing for their end, right? And if you have opposing parties, hopefully between both of those efforts, we figure out what the truth is, or what the ultimate outcome should be. That's kind of a judge or a jury's job. But the drug courts are a cooperative structure, and so you have, basically, and there's various ways that different drug courts and types of programs go about it. But the basic idea is like, we know you stole the car, dude. Like everyone knows you stole the car. It's not like that's
Right.
not really a question. Most vast proportion of our criminal cases get settled in a plea bargain process. So the question is not of guilt. The question is, what do we do about it? Right. And so knowing that, like I stole the dang car, I broke into the house, or I did the thing, right? The question then is, how can how can we prevent this from happening again? Right. The initial impetus for drug courts was, incredibly stacked caseloads in places like Miami and New York and so forth, where they just couldn't handle the load. Like, we need to get people to quit coming back. And
Let
so
me
the
ask you a
idea,
question. What are the
yeah,
criteria for remanding somebody to a drug court rather than the regular court?
well, it's changed over the years for the most part. So, and the federal funding for most drug courts out of the 1990 crime bill introduced by one Joe Biden and some colleagues. In addition to doing a whole bunch of, by my mind, very detrimental things for society about crime and incarceration and so forth. But one thing it did do is fund drug courts, and within that statute, it says very specifically that they cannot accept people accused of violent offenses. And so that's been the standard ever since from 1990. So we're looking at 35 years of drug court practice. And there are some that, find different avenues, different streams of funding and so forth that allow people to come on that are accused of violent offenses. And there's some incredible research that shows those are probably people who really could use the services the most. But generally speaking, nonviolent offenses, they've changed the criteria as far as like the need for actual treatment services. Early in the first decade of drug court operations, there was a tendency to just give everybody a bunch of treatment services. And if somebody shows up and they don't really have that big of a drug problem, and you throw them in a treatment program with a bunch of people that have severe drug problems, could be more detrimental than helpful. And so, I mean, that's an awful answer to your question, Charles, but it kind of depends, right?
It depends.
Most the process, the way it normally works is during the plea negotiation process, usually the prosecutor's office has the discretion on whether drug court is something that they would accept. And then the two parties need to agree that drug court is the option. Usually speaking, there's a guilty plea, and then you go into drug court. And a lot of those cases, at the end of the drug court, a successful completion of drug court program, then the case will be the case will be dismissed, or the felony is not on your record, or sometimes misdemeanor. Sometimes there has been a little bit of innovation in that area as far as doing sort of a pre-conviction, so that even if you do end up not completing the program, you have other options. You haven't pled guilty to the actual crime until you've gone through the full process.
So let me ask you, now that drug courts have been around for over 3 decades, since 1990, what have we learned about their effectiveness?
It's a good question. Well, I mean, I'll say the upshot of some of the work that I've done as far as these sort of innovative approaches to dealing with crime is that it pays to not be a jerk. The incarceration works, but it's incredibly expensive in both terms of dollars spent and lives that are ruined. Like if we incapacitate every single person who commits a crime for a long period of time, of course, crime is going to go down. But at the same time, we're extracting people out of the community, right? And at immense public expense, right? And there's a law of diminishing returns. So the more people we lock up, the more we have to spend per person who we lock up, et cetera. And the less actual crime is prevented. The long-term and actual efficient way to do crime, to deal with crime, is in this idea of prevention. And it's, prevention one in early stages, right? Do we have education? Do we have housing programs? Do we have, mental health and physical health and all these types of things that we know lead to healthier communities? But also people who end up in the criminal legal system, are we connecting them with services that might actually help? There's always the outliers. There's always that, we see an effect size of 50%. That means 50% did not recidivate. Another 50% did, right? But if we look at the counterfactual of 100, or whatever the number would be, our recidivism rates are awful, right? So we're never going to have a silver bullet for these things. But from what I've seen of the research at individual levels and my own research, is that the more effective way of preventing crime and to creating healthy communities, to creating safe communities, is to connect people with needed services.
Sort of a deal with the problem more upstream before it gets too
Yeah, yeah.
downstream.
I mean, at the end of the day, Charles, crime is a symptom of a problem,
Hmm.
right? Nobody just wakes up one day like, today would be a good day to go break into a car.
Right.
You
No,
know,
for sure, for
I'm
sure.
bored. I'm going to go ahead and, go punch somebody on the street,
Right.
right? Like it's,
Which isn't to say there is not some of that and more than there should be, but I take your point. Uh, but no, I mean, these drug courts make intuitive sense. I was just curious, what are the facts on the ground? We've had 30 plus years to do the analysis.
yeah, yeah.
Um,
And so that's generally speaking the impact and sort of the lessons learned. Also, it's we have some structural inequities throughout all of these systems, right? Some of it is, so I have a paper that looks at discretionary arrests, which is drug possession in the presence of a drug court. So it looks like especially in urban centers in the US, highly populous areas, we see an increase in discretionary arrests when the drug court is present, and especially discretionary arrests of minority citizens, especially Black citizens. And so,
why is
there,
that?
so that's a good question. That's kind of open for debate. So if you think about, you a law enforcement officer has discretion on whether to arrest somebody or not
Right.
for something like drug possession. And if the law enforcement officer gets into their idea that, hey, I can help this person by getting them connected with the drug court, right? Then they're approaching it in a way of like getting them in the system is actually helping them. There's a whole bunch of like there's a whole bunch of work out there that shows that's probably not the best way to get people connected with services, right? And especially, one from an effectiveness perspective, if it's somebody, say, their first time, now they're going to jail for the first time. They're getting introduced to all sorts of things that they may not have. But also there's the drag on their life course that being involved in the criminal legal system creates.
Yeah, because that makes a lot of sense because my initial thought was, well, yes, the criminal justice system, it takes a long time for justice to be handed out and
Mm-hmm.
for it to be done, whereas maybe the drug court, it's shorter path. You get a more certain, clearer outcome. I don't know, but what you're saying, mine is probably
Sort
a
of.
little bit too involved, but what you're saying makes a lot of sense. I'm just curious
Yeah.
about that correlation.
Yeah. And so the some of the lessons learned is and I bring up that study in the context of structural inequities because there's a good amount of research that shows there's a over policing problem in urban areas of minority neighborhoods, right? We have when you see sort of a map of arrests, right, and crime rates and stuff like that in places like New York or LA or so forth, like, God, these are bad neighborhoods. And it's like, well, there's also a lot more cops in those neighborhoods, and they're much more likely to arrest somebody in East LA than they are in Beverly Hills. So that's not to say there isn't crime that happens in Beverly
Right,
Hills, but there's fewer cops and there's also
right.
a lot more pushback if they're
Right.
arresting people.
See, that was a little bit of the disconnect because I was ascribing it, to racism, that, cops are going to be more inclined to arrest a person of color. But it didn't quite make sense to me that then they would go for the option that may be a little bit more, oh, I don't know, charitable or something that may
Right,
help
right.
somebody turn their life around
Yeah.
rather than
And
something that's more immediately punitive.
yeah, yeah. And there's also, I mean, it's a puzzle to figure out is the increased arrests. Particularly, I don't know. it's tough too because there's, you're talking about, as far as the rate of saturation, right? The number of actual participants in a drug court or the capacity of a drug court, they are scaled, right? So drug courts, there's many of them in New York City. LA has like 60 different specialty treatment courts, right? So there is that scaling to sort of the local population, but at the same time, like, what's the connection there? It's a puzzle.
Yeah, for sure. Last thing, tell our listeners about some of the work, some of the projects you're involved with presently with Chestnut.
So in addition to so I'm doing the motivational interviewing projects that we talked about.
Right.
I'm also working on a data to action Oregon project. My role on that, so that particular project has to do with the data that's available around substance use and the opioid epidemic. Now it's polysubstance epidemic. And not only the data that's available, but like how people are engaging with that data. Are people going onto a state overdose dashboard and just taking it for, here is what it is. This is the facts on the ground without recognizing the limitations of the data and so forth? Are they using that data to make decisions about policies and programs and funding and so forth without really understanding what that represents? My role on it is we have a community advisory board of people who are in recovery, and they are looking at the general work that the program is doing, and then serving as sort of an extra filter, an extra layer of making sure that the way the products that they're coming up with on how to approach data, what data you can use, and how to use it. They're making sure that those make sense from the perspective of people who actually get the services and so forth. I'm on still a part of the Jeep initiative. I work on a little bit with the community boards. We're actually working on we're working on revamping a set of research priorities that we put together about 2 years ago now. That's everything moves so fast, Charles.
Yes.
We have there's three community boards, peers and providers, young adults who are in recovery, and people who are just previously justice involved. And we set up we worked with them to develop a set of research priorities, what people want to know on the ground. And some of the work that I do is trying to figure out if the research has been done to answer those questions, or do we need to do more research in that specific area? We have a whole bunch of areas. It's on jeepinitiative.org if anyone's interested, but we're going back with those research priorities one more time this year to try and refine them and to see if we can phrase them in ways that would be most useful for researchers, for practitioners, et cetera. And then with the Jeep initiative, and the Jeep initiative is one of a set of NIH funded projects that is meant to build out the infrastructure for research into recovery services and recovery science. Altogether, the group of those funded projects is called the Consortium on Addiction Recovery Science, COARS. And so with the Jeep initiative and with COARS, I host a few forums. We have special interest forums that have to do with specific topics, like we've done recovery housing, MOUD, stigma, peer recovery support services, and there's one going on right now. We're going to have the third session this next month on emerging adults and recovery supports and what that looks like. But then also we have every month what's called the COAR Showcase. And in that, we bring together the different groups. The first round that we went through the showcases was each project within the COARS network brought to the rest of the group kind of exactly what they do, how they're doing it, and any questions they might have for the group. Because within this consortium, you have all of these different projects across the country with really smart people doing amazing work with a lot of experience. And so we realized as we got to the end of all of the groups finally introducing themselves to the rest of the network. God, this is an incredible brain trust. How can we take this and keep it going and utilize it in different ways? And so what we did was we opened it up for is anybody working on a research project? Does anybody have a early phase project that they're thinking about that they want to get going, that they want to get funded? Whatever, are there practitioners on the ground who are really trying to figure out some specific puzzle? MOUD access, peer recovery, support services training, whatever it happens to be, to come to the COAR showcase and tap into that brain trust. And we usually have 30, 40 people on there. Like I said, some amazing, brilliant people from across the country who are working on that.
You're a busy man, Patrick.
Yeah.
You're a busy man. But look, again, really do appreciate you pulling yourself away from all that work, spend some time with me. And I have to say, as I said when we first spoke, I deeply admire how transparent you are in telling your story, sharing your story, actually. So really do appreciate that. And the work you're doing is amazing. So again, thanks so much, Patrick. Really do appreciate it.
Thank you, Charles.
Today I spoke with Patrick Hibbard, Assistant Research Scientist at Chestnut Health Systems. He joined us today from his headquarters in Albuquerque, New Mexico. This is Charles Epstein for the Catalyst Podcast. Thanks for listening.